To start things off, we're going to go to Executive Director Ivy Scobie of the William Booth Special Care Home. Welcome, Ivy.
Welcome. My name is Ivy Scobie, and I'm the Executive Director for the William Booth Special Care Home and also the Regina Wascana Grace Hospice here in Regina, Saskatchewan. Besides our long-term care beds, we are a little bit different. Our home in the name Special Care really reflects what we do. We have our residential long-term care, as I said, but then we have 4 temporary programs that really provides care and attention to those in our community that otherwise may not have a place to be. One of our programs is the respite program, and respite is really care for the caregiver. It's for individuals who are living at home and they are being cared for by either home care or their family. And so they come in anywhere from 1 to 4 weeks to give their caregiver time away to do either go on vacation or just to do some of the appointments and whatnot that they would need to do. Then we also have the Adult Day Support Program, and this program is really a wonderful program. It has approximately 100 participants that attend, and we are open 7 days a week, which is unusual for a day support program, and we're also open on the weekends. And this also provides respite to those who are living in the community, the 100 people living in the community who do require care but are cared for either again by home care or their family member, but just require a little bit more socialization and maybe some daily care such as tub baths or wound dressings, etc. And then we have our convalescent program, which is a subacute program, and it's for individuals, again, living in our community who have either had a major surgery such as a total hip replacement, a total knee replacement, maybe an illness or an accident, and they need more time recuperating. And rather than staying in a acute care hospital, they're able to come to our unit, and we have a full physio department here, and the length of stay on that program is anywhere from 5 days to 5 weeks, and then they're discharged back out to the community. And then our last program is our hospice program. And this hospice program is a 10-bed unit that provides end-of-life palliative care. We have been open since 2005 and been the only hospice in Saskatchewan until just recently. I think there's going to be one opening up in the near future in Saskatoon. So that program is really for individuals who have increased care needs or increased pain management. And it's not a place to die, but it's rather a place to come and live well for the short time that they have left. They don't have to worry about pain management, they don't have to worry about care needs, and their loved one is able to actually go along this journey during a very vulnerable time in their life. All our programs here provide psychosocial, recreation, and of course the physical care. And so we're very happy to meet that gap in our community for individuals that live here. Just to give you an example of how we differ from maybe a different long-term care facility, is a facility our size would have 30 admissions a year. We have 500. So that sort of shows you who we're serving and the scope of our service to the community. We are noted as one of the homes of choice here in Regina with a 2-year waiting list for our long-term care beds. We have a motto here and what we say when we interview staff, and they'll never go wrong if they remember this, is that staff are not working in a workplace. They are working in a residence home. And if they remember that, that sort of sets the expectations for all the care and service that we provide. So everything was going well. We have a very dynamic home. We're moving along, and then March 11th hits. March 11th, the World Health Organization declared a worldwide pandemic, and being part of the world, it affected us too. So everything that we knew, all our processes that we had in place, changed drastically. And I'll just give you a little idea on some stats. The Canadian Patient Safety Institute said that during this time, at the beginning of the COVID, 8 out of 10 deaths were related to long-term care. And the National Institute of Aging said that out of 18,000 cases that first arose, 1/3, actually more than 1/3, 7,000 were people living in a long-term care setting. So that was quite devastating for all long-term cares across Canada. So what we had to do now was we had to take directives from public health and medical health officers, and those directives were mandatory. And so of course we had to do them, and I'll give you a little snapshot of what we did. I first want to say that I'm very happy that none of our staff or our residents have tested positive for COVID-19. And I attribute that to the diligence of our staff and the managers at the front line who have ensured not only at work to keep people safe, but also when they leave here and go home. So we're very happy about that, and we're very proud of that. So what did we do to keep people safe? Well, the first thing we had to do was lock our front door. So when that directive came, the doors were locked. We had to have everybody screened. Only authorized personnel were allowed to come into the facility, and all group sessions were stopped. Our adult day support program, unfortunately, because it was community-based, because of the community spread, had to be suspended. And visitation to all programs, this was a big one, was stopped to all of our programs, with the exception of compassionate visits. And even those were curtailed according to what the medical health officers told us. It was devastating, not only for us, not only for the residents, not only for the staff, but for the families. You can imagine, the families of very vulnerable people who now remember the stats that I talked about. We're hearing these terrible stats from across Canada. And so what were we doing to make people safe? So how did we manage? I'll just give you a few little excerpts of what we did differently. Well, first of all, we had to embrace the medical health officers' directives. So we had to think outside of the box to still maintain some quality of life for our residents. So what we did differently was, well, the first thing we had to do was communicate. I think communication was number one. As I said, the families, now they couldn't come in and visit. They were wondering what's going on. One of the things that we do here at William Booth is when somebody's admitted, we get an email of every single person's family member. And what we do is we were able to email them, and we would email them newsletters, not newsletters, they more of a letter saying what we're doing, this is what's happening today, these are the directives, this is how we're coping. And I got really good feedback from the families on that, because they were able to know that people were safe and that what they heard on the news wasn't happening here. What we did differently. So the first thing we did was virtual visits. We always had virtual visits, but not to the extent that was needed at this time. So we went out and we purchased iPads, we brought in extra staff, and we had bookings all day, all evening, and we had virtual visits with families right across Canada. And I have to say that some of our residents got more visits during the pandemic than they did previous. Because of these virtual visits. So now people could actually book a time, and they could see their loved one, and they could interact. And it was just such a good venue to use during this COVID. The other thing is that no families at the very beginning were not allowed to bring in anything. They weren't allowed to bring in extra treats for the residents. They weren't allowed to bring in clothes, etc. So we decided that we would fill that gap. And so we went out and we set up a nice roving cart, and we had recreation staff take it to all the rooms twice daily, and residents were able to choose whatever they wanted off the cart, and it was free of charge, because really the residents couldn't get it from their family members. So we thought that we would subsidize that. Care needs. Now this is a big one. We have staff that work in various facilities, so we had to cohort our staff. So only the staff that worked at our place could work at our place. We didn't let them work anywhere else, because there could be that spread back and forth. So again, we had to maintain their hours of work, etc. And again, we had to cohort the staff to the different units to keep people safe in case we went into an outbreak. We implemented continuous masking, and that means that as soon as you get to the front door, you are screened, temperature, etc., and you have to wear a mask for the whole time that you're on site here. And so we had to come around with some routines and figure out how that was all going to work. Our recreational groups, as I said, there was no group activities, which is a big part of long-term care. So we had to think outside the box again. And what we did is, remember now, people were in their rooms or only in groups of 5 or maybe 10, but they had to be 6 feet apart. So what we did is we did hallway recreation, and we purchased a PA system that we could, portable one, and we actually did the programs down the 5 different hallways that we have, and residents would come to their rooms. And I think at the little video at the beginning, you saw residents at their doorways, and they were still participating. Chapel, which is foundational to our facility. We have chapel every day, and we have a church service on Sunday. And residents are very keen to attend. And sometimes family members. So we thought, how are we going to do this? Well, we did it the same way. We did 5 mini chapels down the hallways using the portable PA systems. And I have to say that the recreational staff, because obviously the chaplain couldn't do them all, stepped up and they provided wonderful chapel services during the week. Traditionally, in long-term care, we celebrate birthdays because birthdays are important. And this time, I'll just share with you this one birthday that we celebrated. One of our residents became a centurion. She celebrated her 100th anniversary, or not anniversary, well, her anniversary of her birth. And so, so what do you do during a COVID outbreak? They can't have visitors in, we can't really have groups anymore. So again, thinking outside the box, what the staff did was, in the morning, she started off with virtual visits, and she had family right across Canada, from Ontario right through to Victoria. And so she visited with them, and then the staff gussied her all up and got her into nice, wonderful clothing and a crown. Because I mean, when you're 100, you deserve a crown, okay? So she got a crown, and then they proceeded to take her down the 5 hallways, and there was a procession with balloons and everything. And I think you saw that also in that little video at the beginning. And the residents came to their doorways, and they clapped and they sang happy birthday and they cheered, and she just felt like a queen for a day, and so she should. Of course, we ended up with a cake, but of course she had the cake, and we gave cupcakes to everybody else because of the individual portions that we had to provide. We even actually made it to the front page of our local newspaper, and the caption was "A positive during a very trying time," which is the COVID. So it was a positive story during a time. And we also were featured in the Saskatchewan Health Authority newsletter, again, a positive during a very trying time. So going forward, I think if you look forward, we have to look forward far into the future. I think we're in it for the long haul. We're going to have to continue to take orders from the medical health officer. We're going to have to continue to adapt every day because things change every day. And we have to continue to provide quality of life to those we serve. One of the positives that I think has come out of this pandemic, if there can be a positive, is that the face of long-term care the profile has been risen. With all of the bad publicity across Canada about long-term care, what has happened is, healthcare has always sort of looked at acute care, and long-term care was always in the background, especially for funding or for any priorities. And so I think it's taken on a new focus, and I know I've been hearing on the news that different provinces have new incentives. And so I'm hoping that this will continue well into the future. So if anything positive can come from this, that's what has come from the long-term care sector. I guess it's just too bad that it took a pandemic to raise this profile of such a vulnerable population living in our society who actually have founded our communities that we live in. I think that it is going forward. I think that we will do well. I'm very happy to be serving in this capacity of executive director at the William Booth Special Care Home, providing all these various programs to our community, and to be working for a Christian organization that embraces hope, service, dignity, and stewardship as their foundational values. And I think that will see us through any challenges we have in the future. So again, I want to thank you for taking the time to listen to some of the challenges we had in long-term care and how we got through them. And we will work through this. Thank you.
That's amazing, Ivy. So much that you guys had to change, and so many things that you're doing that unless you're part of it, you don't realize. I have a couple questions that I have here for you. I heard change a lot in your presentation. I really liked some of the changes that you've had with visitation, how you've had to bring technology in to help, and how it's actually improving. Do you see these changes in visitation staying after we're able to go back to face-to-face visits?
Well, as I said before, we have always had some form of a virtual visit because we realize people have families across the country and the world. However, we will continue to offer this because, as I said before, it actually opened up visitation for people that maybe only saw their son from Texas twice a year. Well, now they can see him every week. You know, we can schedule a visit. And so it's good for not only the residents, but also for the families. And we certainly will. And changes for the other changes that I think that we will embrace, you know, living in a long-term care facility, you have normal outbreaks, if there's such a thing as a normal outbreak. It's not a pandemic, it's just a normal outbreak. And so I think these hallway visits, you know, the roving treat cart, the chapel that we can provide now down the different hallways, we will continue to do that when we go into just a, you know, a common cold or whatnot, and they deem us an outbreak, we will continue those processes.
Wow, that's perfect. Last question here is, I heard that you had to change things very quickly, like lives were literally at stake when March 11th hit, and you had to shut everything down. Was there anything that kind of surprised you that you never thought that you'd have to do with some of these changes?
Well, one of the more heartbreaking change that we had to do was limit visiting, and especially limit visiting to end of life care, compassionate visits. Remember, we have the hospice here. And so we have people who are in their last few weeks of life, and they're visiting as they knew it before was different. And one of the things that we had to institute was they could only have one designated family member. And so how do you choose one person to come and take that journey with you? I had one lady say to me, but I have two children. Like, how do I pick one? And well enough, how does she? So again, think outside the box. We figured out the window visits, we figured out the virtual so she could see them. And so we were able to accommodate that. But certainly that was one of the more heartbreaking duties that I had, was to implement the medical health officer's directives that said only one person. And I think, you know, lessons will be learned from this, because I know we were allowed to have one person visit. Some places weren't. And I think the lesson learned was that we have to figure out how we can come alongside somebody who's dying, because nobody should have to die alone without that physical touch.
Wow, I completely agree. Ivy, thank you so much for your time today, and we're so glad that you're there.